Hello and welcome to another episode of the Health Notebook. Today we have Abdeyah Richards in the studio and we'll be exploring the avenue of physiotherapy. It's a separate discipline and this is just to make the viewers understand what role a physiotherapist plays in the multi-professional health team. Abdeyah, welcome to the studio.
Shukran for having me.
Abdeyah, can you maybe just tell us a little bit about yourself, what you've studied, and I understand you're a physiotherapist. Can you just elaborate a little bit on your background before explaining to the viewers what a physiotherapist actually does?
Okay. So yes, I am a physiotherapist. I did my 4-year physiotherapy degree at the University of the Western Cape. Thereafter, I completed a year of community service, and I'm currently working at the state hospital. Okay.
Now, if you can just explain to the viewers the whole concept of a physiotherapist and what role does a physiotherapist play in a multi-professional team?
So physiotherapy is a therapeutic approach where we aim to improve the patient's quality of life and improve the activities of daily living through restoring the wellness, and also by implementing physiotherapy techniques and manipulation.
Okay. When you mean activities of daily living, can you just explain to the viewers one or two ideas? What do you mean by improving the activities of daily living?
Okay, so activities of daily living, or ADLs, is what makes our physiotherapy techniques to that patient specific. So whether it's a patient that is at home or doing housework, or whether it's a patient that is working on the buildings, so the activities of daily living will vary, and so will our physiotherapy techniques. So if they are struggling with back pain, for example, it will be difficult to do certain activities, and there we incorporate our treatment to be specific to that patient. So if it was a patient that is doing housework and she can't, for instance, clean the house because of back pain, we will then obviously treat the back pain and improve the pain that she's experiencing. So if we are looking at a patient specific, we're looking at a patient, for instance, at home that's suffering from back pain, that is unable to complete her activities of daily living, which might be cooking, cleaning. We will focus specifically on that activity and then try and incorporate better ways ergonomically for her to achieve her activities of daily living.
So it's a custom-made program taking her existing condition and modifying her practices so that she can continue with her daily activities. Okay. Now, you've mentioned that you cater for a broad range of patients. You've mentioned about the individuals at home. You've mentioned something a little bit about work, and what about children? What role does a physio play in assisting children?
So with pediatric physiotherapy, we focus on, like I say, with across the board, all the interventions that we usually do would be patient specific. So if we're looking at pediatric physiotherapy, we're looking at your development. So have the patients reached their milestones that are age specific? We look at chest physiotherapy. A lot of the times we have chest physio in pediatrics. We look at your development, like I said, so it would be fine motor development, gross motor development as well. And then our therapeutic inputs will then be according to the patient.
Okay, can you maybe just give us one example in terms, I know you've mentioned quite a bit now in terms of fine motor development and different aspects regarding children. Can you just give us a simple, in simple terms, how would a patient present as a child, and what activities would you do to improve this particular individual's fine motor development? Just some basic ideas.
So for example, if you're looking at fine motor activities, we would start off at the posture. So ensuring that the posture is correct, and that is more gross. So it encompasses a broad spectrum. You can't just focus on one specific area. So what we would do, for instance, with a patient that is needs fine motor input, making sure that the posture is correct, and then it will also aid in the ability, for example, to eat, to be able to sit at a table, use the utensils, and just bring the food to the mouth. So fine motor in that way. It's doing so your zip, doing up buttons, tying shoelaces, things like that, that we would obviously then re-educate or implement should that components be missing.
Okay. Now, we've spoken about the different individuals in different environments. So we've spoken about children, we've spoken about the individual within the work environment, and you've mentioned about those people that are at home, and you've given us a few examples about these individuals. Now, I'm looking at it from a different perspective. Now, in terms of medical conditions, now we looked at it from a different category. Now, in terms of medical conditions, can you just run through some of the medical conditions where a physio might add value?
Okay, so within a hospital setting, for example, we have orthopedic patients that are referred to physiotherapy. So for those patients that have gone through total knee replacements, total hip replacements, fractures, dislocations, we're looking at neurology referrals. So when you mean neurology, in simple terms, just to explain to the viewers what value you'd add there. So, for example, stroke rehab. That is one of the most common referrals that we do get from neurology. So taking the patient through the phases of rehabilitation. So when it comes to sudden onset, we are already involved there so that we can get optimal recovery for the patient. The sooner the intervention, the better the prognosis.
Okay, so you've mentioned orthopedics, which is related to fractures and knee replacements. You've mentioned a little bit about strokes. What other areas would a physio play a critical role in?
So as physiotherapists, we do a lot of outreach in the community, especially for those patients that do not have access to facilities, or due to financial constraints, they are not able to attend the appointments. A lot of the time it's patients with disability, so patients that are in the wheelchair, that find it difficult to actually transport or have transport from their home to receive the service. So when we do go back into the community, it's also patient specific. So we look at the patient's environment, what the patient's needs are. That is our number one. And then we plan our intervention around that.
Okay. So it's about going back to that person's home environment, doing an assessment, identifying high risk, and I'm sure you probably involve the family as well, so that they form part of your treatment plan as well.
So family input is vital in the patient's recovery. They need the assistance, they need the support. And it's not only physical support, but emotional as well. To understand the patient's diagnosis, to understand what the patient needs, and then also obviously educating the patient as to what needs to take place in order for the recovery to progress. A lot of the time we find that because of lack of knowledge or lack of understanding, the patient doesn't get the support they need from the families. So the prognosis is not always that good.
Okay, so if you can just explain to the viewers a practical example where you would add value when you go to the community. I know you've mentioned that you would go and do an assessment. Can you just give us an example of a case that you might have seen some time back, of what was actually done from the time that the person was seen at the clinic until he went back home? And so just
I had a stroke patient, or patient recovering from a stroke, and then I did a home visit. The patient had to make use of a wheelchair, so we did the home visit, and then we did what they call a prescription. So what the home environment needs to be adjusted for. So in the home we had the ramp put up so the patient has easy access in and out of the house. Okay. We did changes to the bedroom, so depending on what side the patient had to get in on bed, just to make it easier for the patient, as well as changes within the bathroom setting. We find that privacy is everything, so we want to to make the patient as independent as possible. We make changes to the bathroom, the shower, just so that the patient's safety is number one.
Now, in terms of providing some assistance or giving the viewer some insight in terms of stretching and warming up, what value can physio add, or what comments or what suggestions can you actually provide the viewers in terms of stretching and warming up, and why is it required?
The advice that I always give to my patients is that you have to stretch, you have to warm up before you do a major activity. Even something simple as running, you have to do stretches before and after. A lot of the time the patients would say, no, but I do a 5-minute jog or slow walk, but that is not a warm-up. So the muscles that you use within that specific activity or sport, those are the muscles that need to be prepped. And in order for the muscles to be prepped, you need to do that specific stretches to those muscles. So for instance, if you're going to be running, you need to stretch the lower part of the body. So it is the calves, the hamstring, the quads. Okay, so those are for runners. And then you have your patients that are, for instance, whether they play cricket, whether they play golf, you're going to do warm-ups, you're going to do stretches for those specific parts of the body that are involved, and those include the upper limbs. So you're going to do stretches for those. It's not going to be let's jog 5 minutes and be warming up the whole body. That even though you're getting that increase in heart rate, it's still not preparing the muscles that need to be activated for that specific activity.
So, yeah, so let's assume you have a patient that has a injury. Just run us through the process. You've seen the patient the first time. Just run us through the process. What would you do? And some examples of therapy that you might provide the patient with.
Okay, so physiotherapy sessions usually last between 45. The initial physiotherapy sessions last between 45 to 60 minutes, depending on the complexity of the case. So we do the full assessment includes your past medical history. So we do an holistic assessment. We determine what the needs are for that specific patient. The main goals or the main concerns we take into consideration, and then we work out a treatment plan from there.
Now, I know most people are under the impression that physio is just about massage.
Yes.
Can you just explain to the viewers the other treatment options that you would offer the patient in terms of maybe sauna or dry needling, and what value does that add in your treatment plan?
So in physiotherapy, because it's a hands-on approach, yes, we don't do what they would necessarily term massage, like you're going to the spa. We do hands-on manipulation of the actual muscle or the joint, depending on what part of the body is injured. We do other therapy modalities, would be your heat and your ice therapies. We do, and then other therapy modalities we use is the laser, the ultrasound, and the strapping.
Okay. Now, in terms of working in a multi-professional team, I mean, just elaborate a little bit about that, and how should viewers get in contact with a physiotherapist as well?
Okay, so within the hospital, we work with doctors, psychologists, occupational therapists, your medical officers.
Okay. Now, in terms of getting hold of a physiotherapist, can you just explain to the viewers how do the viewers get hold of the physiotherapist in terms of public and private, and some background in terms of physio specialization as well?
So normally if you visit the GP and they would then refer on should there be a need for physiotherapy. We do practice in the hospitals, we practice in the acute care facilities like your clinics.
And that would be the community health centers?
Yes. We do private practice as well, and there are multiple private practices around. We do schools as well. We do some work in schools, and in the you have the rehabilitation centres that we also work.
And then also just to inform the viewers, you'd also get physios with special interest in certain disciplines as well. Can you just highlight a few of those special interest physios?
So you do have physios that are working, for instance, a sports physiotherapist will specialise in that specific aspect of it. You also get pediatric physiotherapists, you get your orthopedic physiotherapist, and then you get your general. So for instance, in the hospitals, they will designate you to the different
physios associated with that particular discipline.
Yes.
Okay, now just to explain to the viewers, just a typical day in the life of a physio and how rewarding is being a physiotherapist.
A typical day, there's nothing like a typical day. There's always things happening, new things, new cases, new patient conditions, and I think that is what is the most challenging and also most rewarding, because sometimes you find or you feel that the therapy that you are doing, it's slow, but the ultimate goal is achieved. And then you have your patients that are compliant with their home programs that flourish after therapy. And I think the patient progress is what is the most rewarding in physio, because that is why you do it. You do it for the patients, you do it for their full recovery so that they can reach their full potential.
Okay. Now we've reached the end of the show. Can you maybe just give the viewers some advice in terms of physiotherapy? And we'll probably be seeing you again, but can you just set the scene for the next episode, or just give the viewers some advice as well?
The best advice that I can give the viewers is that if you do have pain, seek medical attention.
And this would be, for example, back pain.
Back pain.
Okay.
Because what happens is we are so busy throughout our lives that we continue with this back pain until it forces us to stop what we're doing, and it affects you in the long run. So rather seek medical attention early, or seek early intervention and have a better prognosis than later on when the pain gets worse.
Okay. Now, just to explain to the viewers, we're speaking about back pain, and hopefully in one of the future episodes, Abdeyah will be showing us how to lift up boxes and the correct methodology on how to lift heavy objects. So Abdeyah, it's been a great pleasure having you in the studio.
Thank you for having me.
Yeah. Thank you for watching. Stay tuned for another episode, same time, same place, next week.